So, breast cancer and PCOS, is that something you worry about? I know it's something that we're probably all aware of by now, that there is an increased risk of cancer when you have PCOS. Part of this may be linked to factors like we tend to be more overweight than other women. Part of it may be due to hormonal dysregulation. And part of it is genetics, and sometimes it's exposure to toxins. There's a whole bunch of reasons why breast cancer might be happening for you, or that you might be worried about it. And it's something really important. I'm Dr. Gretchen Kubacki, and I am the founder of PCOS Wellness and the PCOS Psychology Group. And I am here to talk about breast cancer because it's a really important topic that we all need to know about. Statistically speaking, it's one of the most common cancers. It is also, fortunately, at this point, one of the most curable. If detected early, there's a 99% cure rate. That is fairly amazing and wonderful. It's true that cancer sucks, and it can be really, really scary if you are diagnosed with cancer. But I do want you to know, first of all, that it's something where a lot of other women have been through the problem, and there is a lot of support for you. So of course there's this group, which is PCOS Psychology, or there is a ton of support available through the American Cancer Society, the Susan G. Komen Foundation, and through other organizations that work with cancer patients or specifically with breast cancer. And probably you're thinking, am I at higher risk? Well, the truth is nobody knows, because other than having the genes, BRCA1 and BRCA2, that may predispose you to cancer, we really don't know a whole lot about how cancer happens. We know that there are some genes that break or that mutate, or where we have weakened immunity and cells are not getting wiped out when they're, quote, bad cells. But beyond that, sometimes it still really seems to be something random. So how do you handle your fear if you are feeling fearful and anxious about it? Well, for me, the thing is always be informed. You want to be a proactive patient. That's what I'm always teaching and preaching and practicing myself. I never feel like going to the doctor, but I go every year for a gynecological exam and make sure I get a breast exam and a referral for a mammogram. Depending on your doctor and your family history, that should start when you're around 35 or 40. And talk to your doctors about your fears and anxieties. Talk to your friends and your family members about your fears and anxieties. Particularly if you've got a history of breast cancer in your family, maybe find out what it is that was going on for the person or persons who had the breast cancer. And by the way, I'm saying people, not women at this moment, because breast cancer can and does occur in men. So you may not have had a female relative with breast cancer. You may have had a male relative with breast cancer. So it is very important to ask those sorts of questions of your family members, even if it feels awkward and embarrassing or uncomfortable. It's really the best way to keep yourself safe, along with getting regular mammograms, getting breast exams from someone knowledgeable like your doctor, and then of course doing breast self-examination. Every year in October is Breast Cancer Awareness Month, and it's a great time to make those doctor's appointments. Remember to do your breast self-exam, schedule a mammogram if you haven't had one, and ask all the questions. So if you are feeling still really stressed or distressed about the idea of cancer, and I'll talk at some other point about endometrial cancer and other gynecological cancers that may be more common in women with PCOS, but for right now, know that this group is here to support you. And what I want you to do is make sure that you have signed up to get a free chapter of my book so that you can start reading it and start practicing some better healthcare behaviors. We know, or think we know, that stress contributes to the formation of cancer. In any case, if you have cancer or are scared about cancer and have anxiety about it, learning things like meditation, which I'll talk about in my next video, are ways to help contain your anxiety around that. So please drop your comments in the section below. I'll have some links as well for the organizations that I mentioned, and reach out to someone and go with a girlfriend, talk to a girlfriend, stand with each other as you make those appointments. Okay, take care, and I'll see you soon. Thank you.